Hello, and welcome to OurHealth Urban, the health show with an urban perspective. I'm your host, Dr. Herb Smitherman. No matter how long you've been smoking or what health problems you face, quitting will improve the length and quality of your life. But quitting can be a challenge, and when you're learning how to quit, it helps to know what you're up against. On today's program, you'll learn about nicotine and why it makes smoking addictive. You will also learn why quitting is both a physical and mental challenge and why support is important. We'll also be joined by Dr. Alvin Bowles and Dr. Eric Ayers, who will tell us about the damage smoking does to the body. And former smokers share their challenges and success with kicking this addiction. Understand, quitting is difficult. Nicotine is highly addictive. 70% of smokers want to quit, but research has shown that only 3 to 5% of smokers remain quit after 1 year without support. The negative effects of cigarette smoking cause an estimated 443,000 deaths, or nearly 1 out of every 5 deaths each year in the United States. This is more deaths than caused by HIV, illegal drug use, alcohol use, motor vehicle accidents, suicides, and murders combined. We'll help you get ready to quit and get you started on your journey. First up, the physical challenge to why quitting is so hard. Mark Twain once said, "Quitting smoking is easy. I've done it 1,000 times." Maybe you too have tried to quit several times. The reason quitting and staying quit is hard for so many people is because of the drug nicotine. Tobacco contains greater than 250 toxins and cancer-producing agents, plus nicotine. Nicotine is not cancer-producing. It is the substance in cigarettes that cause the addiction. It takes 10 to 20 seconds from the time you take a puff on a cigarette for nicotine to get to the brain. The smoke goes into your lungs, impacting the small airways, gets absorbed quickly into the blood vessels, goes into the heart, and then to the brain. Within a few seconds after the puff, you experience the effect of nicotine. Research shows that nicotine is addictive, and for people who smoke, smoking is more than a habit, it's an addiction, because it causes physical and mental dependence. And it's the addiction to nicotine that makes quitting a physical challenge. Take a look at what happens to the brain when you smoke. The nicotine goes straight to the brain in mere seconds. It then causes a release of a chemical called dopamine, which gives you a feeling of pleasure and calm. Your body doesn't want that feeling to stop. So when nicotine levels and therefore dopamine levels drop between cigarettes, your body craves another cigarette. Even if you want to quit, the body craves the nicotine, and this is what gets you addicted and makes you keep smoking.
I acquired quite an addiction to nicotine, yes. I would just feel like I needed to have the inhale of the tobacco into my system, just to make me calmer. I mean, it's like I just had to have that. Had to have it.
You just learned that nicotine is addictive, which makes quitting a physical challenge. But smoking is also a mental challenge. For many smokers, smoking becomes a habit, a part of their daily routine, which can also make it hard for them to quit. Certain people, places, feelings, and even moods are linked to smoking. These are what we call triggers, and they can be hard to break.
Smoking became a habit and part of my daily routine because I like to drink beer. And usually when you drink beer, you'll smoke more than often than not. I can remember days when I'd be working in my garden, maybe from 8 o'clock in the morning to 8 o'clock in the evening. And as long as I had me a beer and a cigarette, I'd work 16 hours. And I was comfortable with that. but it became obvious that it wasn't a smart thing to do.
Most smokers find that the behavioral or mental part of quitting is the biggest challenge.
Part of it's mental and part of it's physical. When they tell you that nicotine is about as addictive as heroin, I think maybe you better take it into consideration, because it is a cruel mistress.
But the good news is your thinking and behaviors can be changed, and it's important to have a plan in place. That way, you're better prepared to handle both the urge to smoke and the triggers.
You need a plan to quit smoking just like you need a plan in life. I knew that I would have to wait for about 4 weeks before I could get my tooth pulled. And I made it up in my mind that when I go in and have this oral surgery, I wouldn't be able to smoke. But I had already started on a regimen where I would only smoke 2 to 4 cigarettes a day. So I began weaning myself off cigarettes about 4 months ago. But waking up in the morning, you say, I'm not going to smoke, but you'll get 1 and maybe 2. And when I had the surgery, I couldn't smoke at all. And I was looking forward to that day, because I said, if I can make it for 1 full week, I think I can make it over the hump.
Smoking harms nearly every organ in the body. It causes lung cancer, leads to chronic obstructive pulmonary disease or emphysema. It's a major cause of peripheral artery disease and increases your risk of stroke, heart attacks, and cancer. Joining me today to talk about the damaging effects of cigarette smoke is Dr. Alvin Bowles and Dr. Eric Ayers. Dr. Bowles is a pulmonologist with Henry Ford Health System, and Dr. Eric Ayers is an internist and pediatrician at Wayne State University and the Detroit Medical Center. Gentlemen, welcome.
Thank you.
Would it be fair to say that cigarette smoke damages almost every organ in the body?
Yeah. Absolutely.
So what are some of the health risks associated with smoking?
Some of the health risks would be increased in young kids and even up to adolescents, lung disease itself, or increased risk of asthma. It can also lead to arterial disease, as you mentioned, peripheral arterial disease, which effectively is the hardening of the arteries because of the smoking, which can lead to coronary artery disease and stroke. It can have its effect on the skin, in that you have changes of the skin, a darkening of the skin, if you may occur from the smoking, along with some other things that are unique to the disease itself.
So why is it important to stop smoking?
It is important to stop smoking so that any given person can be in much better health. We know that cigarette smoking leads to an earlier death. It would reduce the incidence of lung cancer, and even reduce the incidence of difficulty in breathing associated with that term we call COPD and emphysema. Whenever you see someone coming in with shortness of breath, coughing, and wheezing frequently, and having to be hospitalized or receiving steroids and antibiotics, they can reduce all of that morbidity. And of course, we know that a lot of those people end up on mechanical ventilators and don't make it off the ventilator, and sometimes die as a result of all of that.
So if we have someone out in the audience who wants to stop smoking, sort of what are the steps they need to take in order to do that?
First, they have to, a lot of times it's the physician who is the lead or takes the lead in asking the question.
Visiting their physician is one step.
One step. And ask the question, do you want to stop smoking? And what would be the advantages of stop smoking? And what you will find is some of the failures if you engage in stop smoking, what will keep you from keeping on that task of stopping. And then setting a quit date becomes most important, and being held accountable for that quit date. If an individual also asks for assistance, which may be medical assistance as opposed to going cold turkey, then we should be able to offer that option to them.
So what are some of the medical treatments that are associated with helping people to quit?
When I first entered practice a few years ago,
Okay. Just a few.
just a few years ago, I thought about that, and I said, well, my patients are going to love me, and all I have to do is just tell them to quit smoking, and everybody will quit.
That didn't work?
I did an assessment in 5 years and found that no one quit.
Okay.
I was very disappointed.
Okay.
But I've learned a lot more since that time. And first of all, you got to inquire about in the history, do they smoke? How much do they smoke? Are they interested in quitting? And then help them to assess first of all, the medical problems that can go on with that, and let them know that there are aids out there to help and assist in stopping the smoking.
We also have nicotine products out there. How can patients utilize nicotine-based products to help them quit?
There are, and nicotine products have been out there before Chantix and Wellbutrin as far as options.
So there are oral medications, medications you can take by mouth, but also there's the nicotine-based products.
There's nicotine-based, they're patches,
Okay.
they're inhalation.
Okay.
The biggest thing that we've had, that may be an obstruction if you may, is that what does the insurance company offer also? So the patient may be willing to try a product, and you may offer the product to them, but making sure that it's covered becomes the other thing. And we also have to let the patient know that there may be some failure rate, and that failure is not bad, that we still want to get them back on the road to success, but they have to help us help them through motivation and setting those target dates. And also letting us know if the medicine's not working. Because oftentimes a patient will start out using it, may have a side effect from it, from some flushing or a bad taste or a rash, and they won't tell you to the next visit, which may be 6 months, 4 months down the road. And so the plan now has to be redirect it and drawn up again.
So we talked about oral medications. You talked about Wellbutrin or bupropion. We talked about Chantix. You talked about nicotine-based products. What's also out there is this subject of e-cigarettes. So I'm asking you both, are e-cigarettes considered a treatment option for smoking cessation?
I wouldn't consider them a treatment option because they can preclude the development of cancer because they have carcinogens in them.
Okay.
And so we should not propose an option for treatment that could also cause cancer. So
Okay.
I wouldn't support them. And we have to worry about its infiltration in adolescents because adolescents are starting to use them. And as we know, smoking may be a gateway drug for other drug use.
Okay.
So e-cigarettes may be another way of starting an addictive tendency that may be costly at a young age.
So it's not a treatment option that you recommend?
No.
Yeah,
Okay.
neither would I recommend e-cigarettes.
I got you.
I was going to mention earlier that some of the minimal success that patients I've had with cigarette smoking before we had all these other treatment options was to, if they smoked a pack a day, they would start smoking 18 a day,
Right.
then 15 a day for a while. And some people were successful with that. Even though the numbers were small, it's sort of similar to what people do with nicotine patches. You reduce the amount of nicotine they're getting, and they would do it by just taking less cigarettes per day. And for some of those who have insurance issues with buying the nicotine patches, if you're smoking 20 or whatever you're smoking, cut it down by a few cigarettes per day, few days, and keep going that direction. That may be helpful to do that.
So there are 20 cigarettes in a pack so that the audience knows. So what you're suggesting, Dr. Bowles, is to say that for the first week or two, smoke 18 per day instead of 20. The following 2 weeks, smoke 16 per day. So it's basically...
Or some number like that.
Or some number. Yes. Some number where you're titrating down the number of cigarettes you're using every day. It's a way that people can start weaning off the nicotine if they cannot afford the nicotine-based products over the counter.
That is correct.
Okay.
And it's self-motivating, so it's something that they are in control of themselves also.
Okay, so it also lends itself to more patient-centered control.
Yes.
Okay, thank you. That's very, very important. We're going to take a break and be right back.
The thought of my sons growing up without me inspired me to quit smoking.
I talked to my doctors, and then I threw away all my cigarettes, ashtrays, and lighters.
I started exercising instead of smoking.
Letting my friends online know I was quitting kept me on track.
Staying away from alcohol when I was first quitting was key.
I kept on trying, learned something each time.
Do whatever it takes.
No matter how many times it takes.
We did it. You can too.
For free help, call 1-800-QUIT-NOW.
Welcome back to OurHealth Urban and our discussion on smoking cessation. Now, we had a robust discussion in our last segment, and I want to get into some of the health risks. Can we talk about some of the health risk of smoking?
Yes, we can. So one of the things that it can cause is allergies, okay? Often people will confuse allergies with sinus. And so they'll have a lot of postnasal drip. They'll develop a cough, which can be bronchitis. And it may erode to emphysema or lung disease itself. And so for that reason in itself, it needs to be thought about what they're doing and what they're doing to themselves. Because if it's doing that to the parent in the household, it also can be doing that to the child. And so the secondhand effects of smoke can become very adverse for that child growing up, because it can preclude them to developing asthma and other diseases therein. Okay.
So respiratory problems, sinus problems, allergies, asthma, earaches, ear infections, all of this. Yes. And we see the child in the motor vehicle, in the car, with the windows rolled up, and the adult smoking.
That's right.
And basically the child is trapped in a car seat, bathed in cigarette smoke.
Concentrated in it.
Yes, concentrated.
Because that smoke doesn't go away, even though someone may say so, but it gets into the fabric of the child, and that child then goes to school. They may suffer some bullying or joking, because kids can be harsh, at the same time suffering the effects of the disease itself.
Okay. So Dr. Bowles?
Actually, there's a lot more, in the adult, there's a lot more atherosclerotic cardiovascular disease and heart disease related to cigarette smoking than there is to lung disease. But the obvious lung disease is COPD, a so-called emphysema, and chronic bronchitis. Sometimes they just simply have a lot of cough all the time, bringing up sputum, spitting, and those kind of behaviors. But there's all kind of other problems going on, even hip fractures, stroke risks, and from the vessels and things like that can occur. So all of these problems are associated with tobacco use. When if they had stopped smoking earlier, they wouldn't have that problem. So it's a huge mortality and morbidity associated with tobacco use.
So there's a huge burden of disease related to this. So let's say I were to stop. Does some of that burden go away with time?
Some of it does, but again, damage is damage. If you look at somebody who may be a diabetic and is a smoker, diabetes is a disease that affects the blood vessels in itself, but add smoking on top of that. And so I like to use the example of plumbing, and you're having calcium deposits that are there. And even though the calcium deposits, you can try to change the filter, once they're there, they're hard to get rid of, okay? And that puts a wear and tear on the plumbing itself.
So one issue is the damage that's created, be it in the lung or the heart, not reversible once we stop. However, you won't continue to have damage if you were to stop. So that the damage that's been created, you already have. If the lung tissue is destroyed, that lung tissue is gone. However, if you stop smoking, you won't further damage, for example, the lung in the future.
And that goes to, you have a change in the risk of stroke, heart attack. You might have some better control of your blood pressure with some intervention with medicine and lifestyle modification. But a lot of this is lifestyle choices that we are talking about. And that's the thing, hard to get people to understand that, you made a choice to start smoking. You can make a choice to stop smoking.
Dr. Bowles,
Right,
you get the last word.
It's better not to have the problem in the first place than to try to patch up the problem later on. We just don't have the tools to do that.
Right. So the best prevention is not to start in the first place.
Start in the first
If
place.
you are smoking, the second best option is to try to quit.
Try to quit as soon as possible.
As soon as possible.
At any age.
At any age.
And even though it is smoking of a different type, hookah smoking also raises the risk also. It is smoking also. It is toxic. And so we need to let those that are starting to do that know that it has this risk factor, just like cigarette smoke.
So any inhalation, anything you're putting and inhaling is not good for you or your lungs. Thank you, Dr. Ayers. Thank you, Dr. Bowles. Thank you both for being here. We've learned quite a lot about tobacco cessation.
Thank you.
Cigarette smoking is the #1 preventable cause of disease and premature death in this country, yet more than 45 million Americans still smoke. Secondhand smoke is also a serious concern. There are numerous studies that suggest secondhand smoke causes disease and premature death in children and adults who don't smoke. So please understand, for every 8 smokers that die of tobacco-related disease, they take one non-smoker with them. If you smoke, this may give you just one more reason to quit. According to the Centers for Disease Control, smoking costs the nation $193 billion in health bills and lost productivity. This has led an increasing number of employers to adopt policies against hiring people who smoke.
If a potential employee does test positive for nicotine, they're actually given 90 days and they can reapply for that position or another position. We felt it was important to set a standard not only with us being a smoke-free campus, but also setting the standard with our employees that our new employees that are hired. There have been employees who have had an offer and an offer has had to have been rescinded after the pre-employment screening.
As more companies refuse to hire smokers, your being able to quit smoking may very well determine whether or not you're able to get a job or keep the one you have. You might be wondering what benefits there are to quitting. Well, in addition to all the money you'll save on not buying cigarettes, there are some immediate health benefits. 20 minutes after quitting, your heart rate and blood pressure drop. After 12 hours, the carbon monoxide level in your blood drops to normal. In 2 weeks to 3 months, your circulation improves and your lung function increases. And in 1 to 9 months, coughing and shortness of breath decrease.
When you quit smoking, you look and say, wow, I haven't felt like this in a long time. Feels kind of nice. That's what happens when you stop smoking.
And what about the nicotine? Well, 3 to 4 days after you quit smoking, the nicotine in your body is completely gone, which is good. But what's not so good is that for most people, nicotine withdrawal will begin to peak around this time. On top of feeling the urge to smoke, you may feel dizzy, fatigued, have trouble sleeping and concentrating, feel edgy and agitated, experience restlessness, headaches, increased appetite, and a slower heart rate. Recovery from nicotine addiction is a gradual process. Nicotine replacement and medications can help, but it's also important to get support. Statistics show that the majority of people who try quitting without support are not successful. Smokers who have a quit program in place that includes education about nicotine and a support group do much better. Smoking can have a devastating effect on your life, your health, and your family. This former smoker shares how it impacted her life.
My name is Sharon Thomas. I'm a retired licensed cosmetologist. I smoked from 1955 until 1987. In between that time, I did stop smoking once for 5 months. Yes, I was addicted to cigarettes because I think about it now. When I got up in the morning, I wanted that cup of coffee and that cigarette. Driving the car, I wanted a cigarette before I even backed out. I lit up. It didn't matter if my kids was in the car. You just didn't think about it. You just smoked. I even smoked while I did people's hair. And I can't even fathom me doing that in this day and age with that smoke going over people's hair that I just shampooed. Smoking affected my health in the most negative way. At the age of 47, I had a massive heart attack. After many years, I ended up with pulmonary hypertension. Never heard of it, did not know what it was. I know now. Then some years back, maybe 4 years, I discovered I had COPD and emphysema. And between the heart and the lungs, I'm in trouble. I now have, after the heart attack, I've had plenty of angioplastics, about 4 or 5. I have a defibrillator. If I knew then what I know now, I would never have started smoking. I did stop smoking after the heart attack, but other people in my house didn't. The doctor asked for no smoking in the house. That did not happen. So when I stopped smoking, my husband didn't. He kept smoking. So I was still smoking. You have to make up your mind when you want, if you're ready to quit. I don't care what anybody says. Until you make up your mind, you're not going to stop unless something happens to you like it did for me, and you do not want that to happen. You want to quit on your own because take a look at me and let me be an example for you. You don't. If you stop now, your chances are a lot better than you smoking for 10 more years and going through what I'm going through now. My saying is, if you smoke, stop. If you don't smoke, don't start.
Understanding why quitting is difficult and the benefits of quitting is the first step in your journey to become a non-smoker. And by watching this program, you've accomplished that. The next step is to change your mindset. You must create a mindset for quitting, and you can start by not judging yourself. Understand, on average, in the United States, it takes from 7 to 9 attempts at quitting before you are successful. Not being able to quit in the past is not a character flaw. Nicotine is a powerful, addictive substance, and it can take more than willpower alone to quit. I encourage you to get all the help you can. Quitting can be difficult. Getting both treatment and support will help increase your chances of success. Next, make an appointment with your doctor. Smoking is a treatable medical condition, and chances are your doctor has already helped many smokers quit. If you're thinking about quitting, talk to your doctor and ask about treatment options and support. Don't go it alone. 95% of smokers who try quitting cold turkey are unsuccessful. Start building a support network to help you quit. Enroll in a quit smoking program and tell your friends and family you need their support. And finally, make a plan for quitting. Visit www.mytimetoquit.com today to begin your plan and start your journey. Smoking is a treatable medical condition. Studies show that a combination of treatment and behavioral counseling can significantly increase your chances of quitting. Remember, the average number of quit attempts is 9, so don't give up. Talk to your doctor about quitting and the treatment options that are right for you. A combination of treatment and support will help you overcome both the physical and mental challenges to help you succeed. So thank you for watching, and remember, every smoker was once a non-smoker, so never quit quitting.
I did it, and you can too.
I did it. I quit. And you can too.
I did it, and so can you.